Hi, Robin.
Hello.
I'm Angie, and I am doing an interview for my speech class. In our speech class, we're learning that it is important for communication. We're learning different styles of communication. I was supposed to interview Vicki Still for this project, and your supervisor called me yesterday and said that Vicki was sick and had been put in the hospital. So she recommended me to interview you. So I really appreciate you stepping in and taking Vicki's spot so that I can get this done.
You're welcome.
So what do you do in the hospital that your supervisor had recommended me? What is your job title and what is your job duties?
I'm the Director of Case Management/Utilization Review. I'm also the swing bed coordinator, QI coordinator. I do peer review and quality works for the hospital. I've been in this position for 7 years. My main job is to make sure that all the patients that are admitted into the hospital qualify to be here. We use interqual criteria here at the hospital. I have a software program, and that's kind of how I determine this. I also do all the pre-certifications on the patients that have been admitted to the hospital, either observation, inpatient, or swing bed, and I get their insurances to approve it. So that's my main job. I also do, like I said, QI coordinator, so all of our quality improvement activities at the hospital, I coordinate all that. I do the minutes, I coordinate the meetings. Swing bed coordinator, if a patient needs maybe some physical therapy, occupational therapy, or IV antibiotics for a little bit longer than their acute care stay, I coordinate that. We get some patients from the city sometimes that need some rehab, so I get all that coordinated with the patients' families and their doctors for them to come here at the hospital. And I also mentioned too, I do peer review with the doctors, and they have to have so many charts reviewed quarterly. So we do that, and we have a meeting quarterly about that, and then Quality Works, which is a program that we do on pneumonia, heart failure, and acute MIs. And it just looks at, and there's certain criteria that they recommend for this type of patients, and we just look at those charts and see if they met those qualifications. So those are my main jobs. I also, my supervisor, Crystal Hicks, is our chief nursing supervisor, and usually whenever she is gone, I'm in charge. So I get to deal with staffing issues or medication errors, anything like that kind of comes up whenever she's gone.
Sounds like a lot of communication on your part. So how many different people in a typical day as a nurse and doing your position do you have to come in contact with to communicate?
A lot. Obviously, the nursing staff is very important and a crucial part in my role. Also, of course, the doctors. Their staff too, because I have to call the doctor's offices a lot, so their staff plays a big role in that also. And then, you just look at the whole hospital in general. I'm dealing with the insurance girls to get patients pre-certified, and if there's any insurance problems, we have to get that worked out. One very important part I forgot that I do is risk management. I can't believe I left that out. So if there's any patient complaints, billing complaints, anything like that, then I deal with those. So where that comes into play would be our patient accounts. So she gets complaints sometimes about the bills and stuff, and so then that goes to me to get resolved or look into. But it just kind of really everybody in the hospital. My QI responsibilities go into all the supervisors at the hospital, our administrator, the secretary. I could go on and on. I feel like I have to communicate with a lot of people.
Okay, I've done some research online and some other resources about registered nurses in hospital settings. So is there going to be a time whenever we're to be able to be qualified for like a type of job in a hospital setting that we are going to have as many of the qualifications that you have? Or do you think associates is far enough in nursing? What do you recommend?
I think for right now an associate is. I think that's the trend you see is that a lot of hospitals only hire associate degree nurses, or at least bachelor prepared nurses. I think, over the years, and I'm sure you've probably seen it too, it seems like the LPNs are getting phased out. I think they're very important to our facility and the role that they play, but I just feel like all these rules are coming from Medicare and they're just getting phased out. It just seems like there's more and more things they're not allowing LPNs to do, and so then that makes it hard for us as a facility to run on a daily basis when LPNs are getting, excuse me, excluded from these responsibilities and only RNs can do it. And then that's putting more pressure onto the RNs, more responsibilities, when if we would just hire an RN for that role, then that would kind of fulfill that. And I know there's been talk for years about your entry-level position into the nursing field was going to be your bachelor of prepared nurse, but I still think we're years away from that. But I do know if you want to advance in nursing, maybe around in the smaller towns it doesn't matter as much, but it seems like when you go to the city, a lot of them want bachelor prepared. If you're wanting to go into like a leadership position or anything.
So as far as experience goes for anybody who would want to apply for a nursing position, is it better to have more experience to be able to be hired in a hospital than it is to come directly out of a nursing school and apply?
I think if you have experience, I think that sure helps. Whenever you're in the interview process and you hear their background, and let's say they were, CNA or something like that, then you know that they know kind of the basics and know a little bit about how things are run. So I do think that is important, and it plays a big role, especially if you're competing for a job. I don't think it's required, but I do think it would help. And I think, you're going to know some of the nursing terminology and things like that.
That definitely helps with communication with doctors and other departments.
Right. And also with the orders, in nursing we have all of our little abbreviations. And usually if you're a CNA or something like that, you know most of those, so that really helps out.
So you as a nurse working with patients, what do you feel that you contribute to them?
I would like to think I contribute, passion towards their care, and that I really do care that they get better. That's kind of a goal with our whole team here at the hospital. We have the social worker, myself, of course the nursing staff, and the doctor, and I feel like we make a good team to make sure that we're giving the best care possible to that patient for a good outcome. And I think that's everybody's goal. So I hope that I contribute, some part to that.
Your supervisor said that you currently are in school right now for your master's, so you've done your associate's RN and you've done your bachelor's RN.
Mm-hmm.
So what has motivated you to continue on into master's for nursing?
There was a lot of decisions, going into that. A lot of decisions to be made to go into that. It's something I kind of always wanted. I always wanted my bachelor's from the get-go. I thought when I got done with my bachelor's I was going to go straight into my master's, but I took a little break, and then I decided to go into it. I taught a little bit, and I know, I taught at North Central Missouri College as an adjunct teacher for maternal child 1 and 2, and you have to have your bachelor's to do that. But I think there has to be a mixture with your master's also. But anyway, I really enjoyed that. And so that was kind of one of my reasons for going into my master's. Because I thought, you never know what the future holds. And, right now my children are really young and I don't want to change anything right now. But you never know in the future I may want to. And it just seems like there's a lot of colleges online, there's a lot of opportunities online, and I just thought, you never know, that might be something I want to do in the future. And I love learning. I love learning new things. I really enjoy it. And so I just thought that would be a good next step for me right now.
So for teaching, do you have to have a master's, or do you say just bachelor's?
I know through North Central, the way I understand it, you have to be one above what you're teaching. So I know I was able to teach the LPNs with my bachelor's, and I think you can with your RN too. I know there's some rules that my supervisor was telling me that was possibly be changed, where they have to have a mixture of master's and bachelor's degree nurses to do that. I know they do for free to have your master's, and of course pay-wise that makes a difference too if you have your bachelor's or master's. But I think you can teach like at the community college for your with your bachelor's to do that.
Are you still teaching for the North Central College?
I'm not going to do the class that I taught last year just because of the way the schedule fell with my children in sports, but I am going to do pharmacology, so that'll be new for me. So I'm excited about it, though. I'm excited for the challenge. One thing I was going to say about the degree that you needed, I did look into a full-time position that they had open, and she did say within, like, a year, well, what was it, 2 or 3 years, I think is what she told me, they would like us to have our master's. So she wanted to know if I was willing to, do that. So I think if you're going to do it full-time, that's what it sounds like.
Okay. So as an applicant, when I'm finished with school and I, pick where I am going to apply for my job, what are some of the most important characteristics that I can have as an applicant for an RN job in a hospital?
I think confidence is a big one. A nice attribute to have. I think just knowing that you're a caring individual, you're hardworking, you're loyal. I think if you could show all those characteristics in your interview, that really helps. I've been on several of the interviews that my supervisor has done, and you would tell about a person when you first meet them. You can tell by how they're dressed, how they're talking to us, just everything. It makes a big influence on us.
So again, that's where communication comes in as a very important part to be able to communicate. So where do you see yourself and your career in the next 5 years?
I am hoping to have my master's within 2 years. It may take 2.5, but I don't see me changing anything right now. I love my job. I like what I do on a daily basis. I love my coworkers, everybody. My children are young right now, so I can't see me moving or making a big change right now. I do see in the future, education, possibly. That's what I'm concentrating in on my master's degree. So I do see that sometime. I just don't know when. And you just never knew what's going to happen. But right now, I really do enjoy my job, so I really see me staying here.
And as far as this facility that you're working in, do you see growth within this facility and expanding?
Especially here recently, since we've got a new administrator, it seems like things have changed a lot. I know we just acquired another family practice office, and then I know he's planning on building one in Eagleville, and it just seems like we're making a lot of growth, a lot of expanding. I know one of our medical clinics, we opened up kind of a convenient care clinic on the evenings and weekends, so I think that's really good for the community, and so yeah, I definitely see growth happening in our facility, and I'm really excited for where we're going too.
Sounds good.
Yeah.
So, I've covered with you responsibilities and some educational requirements for a job as a registered nurse. So I really appreciate your time that you've taken to do this interview with me and give me some helpful information and some encouraging information. So if I come up with any questions later, would it be okay if I could contact you if I have any further questions or anything?
Yes, I'd be happy to help you.
I really appreciate you taking the time, stepping in for Vicki, and I hope that she gets better, so if you happen to see her, if you could relay that information for me.
I will. Okay, thank you. Good luck with everything.
Thank you.